361 people have died in China so far. 17,000 people are confirmed infected. 28,500 people are suspected of infection, and 1,52,000 odd people are currently being watched very closely by the doctors. Now, we know that this could have come, according to China, from a wild animal carcass that was being traded, but we know for sure right now that it's going from human to human. There are 150 people infected outside of China, and it's gone to 24 countries. Now, here's the truth about what we don't know. There is no specific medicine recommended to prevent or to treat the coronavirus, and this is according to the World Health Organization, because apparently doctors are still trying to figure out what to do. So there's no vaccine and there's no treatment. Now, there has been, of course, on WhatsApp and on Facebook, viral information on how you can boil garlic and you can take this and that sort of treatment, and you can either immune yourself or protect yourself or cure yourself. None of those things are true, apparently. But the worst of all of this is the government's own advisory. The government of India's Ayush Ministry has actually put out prevention and symptom management for the coronavirus based on Ayurveda, homeopathy and Unani. Now, the Indian Medical Association of Doctors have responded saying that this is premature and this is quite dangerous, because when something is spreading so fast, to actually tell people you can solve the problem by using home remedies at home is actually a very dangerous thing to do. And to help us understand what's really going on with this virus and what we should be believing and what we shouldn't be believing, joining me in the studio right now, Dr. Sanjeev Mehta, the Chief Pulmonologist at Lilavati Hospital. Doc, thank you so much for coming into our first show. I'm proud to have you.
Congratulations.
Thank you.
Thank you for inviting me.
So, unfortunately, the coronavirus, obviously, I'm assuming as a pulmonologist, this is something that worries you, keeps you up at night?
It does. I think it keeps a lot of people up at night. So, a couple of things. Viruses and viral infections to humans are not new.
Yes.
This has been happening from time to time. So just to give you an idea, these normal cough and cold viruses usually shift their pattern, and these are called just shifts or drifts in the way the virus is. It fights our immunity. We get a cold, we are okay. Once in a while, what happens is exactly what you said. The virus jumps from the animal to the human. Now, we have no immunity against this particular kind of virus because humans have not seen it before.
Yes.
Therefore, it is able to launch a massive attack on the human being, and there is a lot more seriousness in such patients. Now, this happened at the time of the SARS virus.
Yes, I was just going to ask you, is this worse than SARS, better than SARS? Do we even know?
Yeah, I think, the last choice. We don't know. I don't think we'll know because we never get honest figures from China. Okay. I don't mean to be political about this, but we did a calculation. The first calculations that came out was that it was milder than SARS.
Yes.
In the SARS, the infection ratio was something like 10. This is 2.5. But now the figures seem to be showing that it is more because now the deaths are piling up. There's a lot of concern amongst people is whether we're actually getting all the figures, because some patients who are suffering from this are being labeled as pneumonia to show
a lower number.
To show a lower number.
So it might definitely be worse than what we know, or worse than what I called out.
Yes.
It can't be better.
No, it's not.
It's unlikely to be.
Yeah.
Yes, unlikely to be exaggerated, those numbers.
Yeah, I mean, there's a lot. I think the number of patients who are infected, and so again, these are all viral social media things, is that the number of patients who are really exposed to the virus and probably infected is many folds more than what China is telling us.
So if you actually look at the virus at this point, I understand that it takes about 12 days to manifest after it hits your system, which means people could be walking around with the virus right now and not know about it. Is that true?
That's correct. And that's the more scary part of this virus compared to SARS.
Okay.
In SARS, what happened was, as soon as the infection got to a human host, very quickly in a day or two, the patient would become sick.
And show symptoms
something. You could go to the doctor.
Yes.
The problem here is, and this is exactly what happened in the first 15 days or so, patient feels nothing, but he transmits.
Oh, God. Okay.
So then he would be walking around the airport, and that's how it spread. It goes very quickly to people. He says, I'm fine. And he passes the thermal test. The thermal test is really
It's
inadequate.
So we don't even know how to detect at this point.
Well, there are tests, there's a blood test, but you're going to first suspect it and then detect
Yes,
it.
yes.
And I don't think India is yet ready with all the tests. We have a few, and that's how they got those guys in Kerala. So tests are available, but you got to suspect it first.
You've got to suspect and test first. Now, this brings me to the next point. And I'll get to the stuff that's going viral on WhatsApp and on Facebook, but I'm concerned about what the Indian government has put out. And, you know, people are more likely or far more likely to believe it if it comes from the Indian government or its official sources, saying you can take Ayurvedic medicine to prevent and to manage symptoms. Now, I'm not, again, like I said, I'm not going to read out this advice because it's dangerous to actually read out the advice. Could you tell me why you think it's dangerous and what your opinion is of this advice?
So, being a doctor, I haven't gone through so much of the advice, which is not allopathy. So, in my field, the advice is prevention. And we as allopaths know that there is, at this point in time, no direct antiviral treatment.
Yes.
So, though there is a couple of interesting case reports, but I don't think these are substantiated yet in the Western literature. They've tried some antiviral medicines, but not substantiated right now. I was smiling because it's all over social network, right? From papita leaves to
Yes.
garlic.
Yes, garlic seems to be a favorite of, a lot of this. Like, boil the garlic, yes.
No, the garlic came from, I believe, the Chinese who said...
who have sorely failed to convey this. But my concern here, and especially since you said that it takes 12 days to manifest or to actually see any symptoms, for someone to assume that I am, based on what the government has told me, stirring up some powders and drinking it and managing this, or I've immuned myself, or I managed to control the symptoms, every day you do that, you run the risk of infecting more people, isn't that true? And not going to a doctor. So this is not something that ought to be taken lightly.
You should not, I mean, as an allopath, I can't substantiate it, and I would say go to your doctor.
Go to your doctor.
Go to your doctor, talk to them, and then tell them that these are the symptoms that you're suffering from.
The Indian, I'm going to push you a little bit
Yeah,
here.
sure,
I know
please.
you're extremely polite, but the Indian Medical Association has called the government's advisory immature, premature, and irresponsible. Do you agree with all of those or one of those?
Yeah, because see, I haven't read the advisory, but
I can tell
would.
you can imagine what it is.
Yeah,
Yes.
I can imagine. So if it is based on non-allopathy, then I would agree with what they said. Because honestly, nothing has been studied, right?
Yes. Nothing
So-
has been. So we know for sure that there is no vaccine
That is true.
as of now that we know
is
of.
true. That is true.
There is no, there's no treatment that we know of.
There is no treatment.
Doctors or research teams around the world are still trying to figure out this virus or the microorganism that's causing it. We don't know for sure. And so any sort of assumption of cure or prevention is premature.
Absolutely. There's no, I completely agree with you. We don't have a cure, and anybody saying that he has a cure is not saying the truth.
Is not saying the truth, including the government of India, if that be the case. What you should be doing, first of all, go to your doctor as soon as you feel sick. Any sort of sick, what kind of symptoms are we looking at?
So that's a very good point. We don't. So the first few days you're going to feel normal, and that's where that's concern is, and we don't know how much in an individual that would be. Maybe 4 days, 5 days, 6 days. Then you would start with normal cold and cough symptoms, and that you would just think it's a normal flu which you're having. It's only later, say by day 7 and day 8, when the person will become short of breath, then get fevers, body aches, in some cases even diarrhea, like a normal viral infection. I mean, like a severe viral infection. And by the time they go, it's already 14 days. He's spread the virus to a lot of people in that much time.
So, go to a doctor as soon as I have a cold? Would that be, I mean,
So, yeah,
precautionary,
so
would that be a wise thing to do?
You're right. We don't go to a doctor just like that. But if you have been in contact with somebody who has, so that's an advisory as I'm given to understand, and that's in the US, that if you have symptoms of a common cold, you don't need to go to a doctor.
Okay.
But if you have been either yourself or in close contact with somebody who has been to China, then and you have a cold, now it's the time to go.
Okay. So, okay, what if 6 degrees of separation? I've been in contact with someone who's been in contact with someone. It's really difficult to tell at this point, isn't it? Because people travel so much. But you're saying make it a point to just keep a track of these things.
So it's a good question. I would say 1 to 2 degrees of separation, go.
Okay, go to
Not
the doctor.
6.
Yeah.
The reason is that up until now, this is an animal virus which jumped to the human host. But we definitely now have human-to-human transmission. So if you did meet with somebody who met with somebody from China, I would yet go and seek advice. But at this moment, we do not have evidence of far repeated transmissions. My point being, if you look at the US, all the cases that have come in, to the best of my knowledge, I could be wrong because the science changes every day and information is changing every day. But to the best of my knowledge, all the cases that were in China, that came to US and the Western world, were direct imports from China. Within the US and within other countries that I'm aware of, it hasn't really shown much human-to-human transmission.
Yes.
I don't know the reason for that. Maybe they're now being separated out, being quarantined, or maybe as the virus jumps from one host to the other, it loses. We know it loses its virulence.
Yes.
It becomes less potent.
Yes.
So maybe by the second or the third jump to human, it has lost its virulence. Maybe the case. I won't bet on it. But yes, at the moment the recommendation is that, you know, if you've had a contact with a contact, is maybe you need to talk about it. But anything beyond that, so far human is. And
obviously completely avoid travel to Southeast Asia, China, parts of that part of the world.
Yeah, okay. So China is, I think, really right now not the best place to go.
Yes.
Southeast Asia.
It's difficult to tell.
It's difficult to tell. There isn't that science to support a ban, but I would completely agree that, you know, avoid unessential travel.
So I do want to ask you this. You said you don't believe that India is properly prepared at this point. Given the density of population, given the fact that we have so many strains of drug-resistant viruses in India right now, are we a hotbed for this sort of thing, or will the virus die because we're just so immune ourselves after all this?
If I have the time, I'll answer this in two parts. Part one, I think we are really inadequately prepared to deal with contagion. Because our population density is so huge and we don't have the facilities nor the will to do the kind of isolation that China did.
Yes.
So one person sneezes in the Mumbai trains and it is across the city.
Yes.
It is really that bad. There's no isolation. We don't have that many hospital beds of isolation.
Yes, we don't have that many hospital beds.
Okay. And especially within the hospital, isolation beds are not that many. There'll be probably 4 in a hospital. How do you deal with such a large epidemic unless you turn the whole hospital into isolation hospital? We don't have that many yet, but these are good wake-up calls because we are better prepared than when the SARS hit us. But we yet need to go. So that's point number one. That was whether we are prepared or not. I think we need to do much more in terms of planning and everything, masks, isolations and all of that. That being said, your question is, are we going to be in a worse state? And I don't know. If I look at SARS and MERS, they came to India.
Yes.
But they didn't do any significant damage. They didn't do any damage. So the question is it the temperature? Or do we have a lot of infections in the past so we have better immunity? But they didn't do anything.
Yeah. So
we're keeping our fingers crossed.
We're keeping our fingers crossed. So the truth about this, though, is the one thing that's uniform across this whole thing is that we don't know. We don't know, and nobody knows across the world right now. So anyone pretending to know is probably making that up or lying to you. Thank you for being a guest on our first show.
I'm honored. Thank you.